Next, we'll hear from Ms. Ma with Health Access California.
Okay.
Welcome.
Right, thank you. Good afternoon, Commissioner. My name is Tam Ma, and I represent Health Access California, which works to ensure that all Californians have access to quality and affordable health care. Anthem has had significant problems abiding by basic consumer protections, and it should not be allowed to get bigger unless it is forced to get better. We oppose this merger unless it includes conditions to ensure that consumers get the quality care they are entitled to, and that there is a guarantee that Anthem will not proceed with unreasonable rate increases. A merger without these conditions is absolutely unacceptable. Your review of this merger and the resulting findings and recommendations should place a strong emphasis on Anthem's track record of not abiding by basic consumer protections. It is relevant to look at oversight and enforcement actions from all California regulators, because problems that are present in one line of business are likely to manifest themselves across the company. I'm going to focus my remarks on some of the challenges that consumers have with Anthem, starting with its grievance systems. In Anthem's most recent routine medical survey at the Department of Managed Healthcare, 5 out of the 7 major deficiencies found are rooted in its poor handling of grievances. The DMHC found that consumer complaints were not adequately investigated or resolved because Anthem misclassified them as inquiries instead of grievances. In addition, Anthem does not always do its due diligence when reviewing complaints. As a result, critical facts or solutions were overlooked, leaving consumers without needed medications or stuck with bills that they should not have to pay. Anthem has also failed to provide its consumers with language assistance, as it is obliged to do under the law. Anthem has not assessed the language needs of its current enrollees. As a result, some patients are unable to communicate with their providers. These issues are particularly important in California because 40% of consumers who receive coverage through Medi-Cal or subsidized coverage through Covered California are limited English proficient. The fact that Anthem is not complying with language access requirements is a critical indicator that it may not be providing quality care to all of its enrollees. Anthem has also had notoriously inaccurate provider directories, making it difficult for consumers to know which doctors are in-network and which doctors are actually accepting new patients. Last year, the California State Auditor found that 23% of the information in Anthem's Medi-Cal directory for Fresno County to be inaccurate. Anthem also received a $250,000 fine for inaccuracies in its directory for the individual market. These issues leave us wondering whether Anthem actually has adequate provider networks for its consumers. Anthem also has low quality ratings in some key areas such as customer service. Both its HMO and PPO products received 2 out of 4 stars in Covered California's quality ratings, meaning it scored between the 25th and 50th percentile of all plans. Finally, Anthem's Medi-Cal plan has below average quality ratings from the National Committee for Quality Assurance. Consumers and taxpayers spend a lot of money purchasing coverage from Anthem, and they should not have to settle for less than average quality. Given these deficiencies, we do not think Anthem should be allowed to get bigger unless it cleans up its act before this deal closes. And as you alluded to earlier, Anthem has had a record of proceeding with rates increases that are found to be unreasonable by state regulators. And as other panelists and testifiers today have mentioned, studies have shown that insurer mergers have led to premium increases, even as insurers that have larger market share are able to get lower rates from providers. Despite this, we have a lot of concerns about Anthem and their excuse me, we're very skeptical that this merger is actually in the interest of consumers because we think that with the greater market share that Anthem will have as a result of this merger, that they will continue to pursue unreasonable rate increases. And we strongly urge that any approval of this merger include a condition that requires them to not proceed with unreasonable rate increases. And if they cannot commit to that, then this merger must be blocked. We concur with the concerns raised by other witnesses today about how this merger will increase concentration and limit competition in every segment of California's commercial market, which is already highly concentrated. And according to an analysis by Catano and Stroud, a merger between Anthem and Cigna is likely to reduce competition in 31 counties. And as others have mentioned, this merger also has a significant impact on the ASO market. According to a study in the Health Affairs Journal, California is one of 5 states that will see the biggest increase in ASO market concentration, which is projected to increase by 39%. The anti-competitive effects of this merger, coupled with Anthem's poor track record, makes it really highly likely that quality will continue to go down while prices will continue to go up. That is why we have asked regulators to impose strong, enforceable conditions to ensure that consumers will actually benefit in the form of lower premiums, lower out-of-pocket costs, higher quality care, and reduced health disparities. In closing, we respectfully ask you to include in your report a thorough assessment of Anthem's track record on consumer protections and unreasonable rate increases, along with recommendations for conditions that must be included in order for this deal to bring any benefit to consumers. We thank you for holding this hearing and for allowing consumer advocates and members of the public to share our comments. And I also have a question for Anthem, and may I ask it at this time?
What I think I'd like to do is get through all the testimony, and then if you have a question, I understand that Ms. Imholtz may have a question, then we could pose that question at that time.
Okay.
Great.
Sure. Thank you.
Wonderful. Thank you, Ms. Ma, and I also want to note that you're joined by your very able executive director, Mr. Anthony Wright, and we're delighted to have both of you here, and we really appreciate the thoroughness of your written testimony and your verbal testimony as well. Thank you. Next.